Does the Moderna 2-dose vaccination sequence need a booster? Well, the FDA is going to weigh in on that decision in the advisory committee meeting coming later this week. I've had a chance now to read the guidance documentation provided by the FDA for the ongoing discussion, and it is quite interesting. Now, of course, Moderna always had a higher dose than the Pfizer vaccine. The dose in Moderna, 100 micrograms, was 2.3 times as much as the Pfizer dose. Now, Moderna is submitting an EUA for a 1-dose booster at 50 micrograms, half the dose of the first 2 shots. And it is going to go to the advisory committee, and it is going to be quite interesting. They're seeking an EUA in the exact same population, the over 65 or for under 65 if you're at high risk of coming into contact with SARS-CoV-2 or getting really sick from SARS-CoV-2, that population. Not everybody. Pfizer couldn't get it, and Moderna certainly doesn't even aspire to get it. But it looks like they're looking at the exact same population. And they are submitting data that supposedly makes the case for boosters. What do I think about all this? I looked through the FDA documentation, and it smells to me as if reviewers inside the FDA are not so keen on this decision. They're not coming out strongly in favor of this. They seem to be equivocating a bit. Why might that be the case? Well, the Moderna dose was always higher, and that meant a few things. One, it goes hand in hand with, I should say goes hand in hand with rather than it means, because we don't know necessarily that that's the reason why, but it goes hand in hand with very good vaccine efficacy for bad endpoints, severe disease and hospitalization. Moderna continues to enjoy 90+% protection against those endpoints in real-world observational studies, for whatever it's worth. Moderna also is coming with a higher rate of myocarditis, particularly in boys between the ages of 12 and 24, which is the highest age group. In the FDA guidance documents, they say that the rate in some data sets is as high as 200 and some change out of 1 million, which is roughly 1 in 4,000, which it turns out is a little bit more frequent than some of the most controversial estimates that got people in a lot of trouble. But it looks like this myocarditis is a real safety signal, and it is not infrequent. Now, Moderna is seeking EUA for the booster. I have a lot of thoughts here. One, if you want to persuade me that a booster is beneficial, I don't want to see vaccine efficacy data. I don't want to see an increase in the geometric mean titer of antibody. I want to see in a randomized fashion that people who get boosters do better than people who don't get boosters, that they're less likely to get severely ill from SARS-CoV-2. That's the standard in my mind for what justifies a booster, a randomized study that shows people benefit from getting the booster. That's a very fair standard in evidence-based medicine. They're not meeting that standard. They are submitting an EUA on the basis of non-inferior geometric mean titers of antibody. All that means is we can boost the antibody titer. But do you actually do better as a result? Or is there anything to improve upon? Is an open question that these results do not yet get into. My next point, the use of EUA. When will the EUA stop? When do we have to go to the formal FDA approval BLA process? Are we going to have EUAs for the 3rd, the 4th, the 5th, the annual booster? How much can you get out of an EUA? Is it truly an emergency for someone who's had 2 Moderna vaccinations? Are they facing an emergency at any age? Is there an emergency going on in that group that the EUA authority is warranted? I think this is an important regulatory question. As someone who studied regulatory systems for many years, published 2 books on the topic, I struggle to make the case that the EUA authority is warranted here. We've seen in oncology the accelerated approval pathway, which was meant to do one thing, has been widely used for almost everything in oncology. Is that the future of vaccines and EUA? If so, I have a lot of reasons to be concerned about that. Reading into this packet, I see an FDA staff that, in my opinion, seems reluctant to move forward with this Moderna booster. We shall see what the meeting holds. We've already seen that the director and the deputy director have resigned, and they're going to be retiring at the end of the next couple months. This does not bode well. I mean, this is what we were worried about. What is going on at the FDA? How much pressure are these reviewers under to make these booster authorizations go through? Is this the appropriate regulatory pathway? What data do we really need? I struggle with Moderna Booster. I really do. You're talking about a vaccination series of 2 shots that's got 90+% real-world effectiveness data. You can boost the antibodies, sure. It turns out, did you know, the human body doesn't always make all of the antibodies for every antigen you've ever been exposed to. The reason being, if you always made all antibodies for everything you've ever been exposed to in your life, your blood would be as thick as molasses, and we can't have that. We have a system in place, an immune system, that when it needs to, it can rev up the production of these antibodies. Now, that's not an argument that the booster works or doesn't work. It's just another argument for why it might not necessarily confer benefit, and the only way to settle this is a randomized control trial measuring the endpoints you actually care about. I really don't understand why we're not doing it. I am concerned about the process, and well, we shall see. I think this is not going to go the same way the Pfizer booster went. I mean, there was a lot of political pressure to make that September 20th deadline that the president set out. I don't know where the president got the September 20th deadline from, but they put it out there, and there was a lot of pressure to make sure we had a booster by that week. But now that's happened, and so I think arguably there's less pressure, less eyes on this decision. Maybe it's time to take a pause and think about this a little bit more carefully. I'm somebody who's very interested in regulatory science, and I think it's important to have flexibility in regulatory pathways. When things are really dire, you need flexibility to bring products to market very quickly. I was a big supporter for the original EUA of the Pfizer vaccine. Thought it was spectacular. But at some point, you need to get better and more credible data. You can't continue to use the exigent circumstances that were present in the past, may not be present in the future, to justify a lower regulatory bar. And in fact, the central lesson of both books I've written is that low regulatory standards have a price. They have a price for patients and doctors. They leave us with a lot of uncertainty. So I will be watching very closely this Moderna hearing, and I will want to know. And I also want to know about J&J. I really want to know. I have a lot more questions about J&J, like why we're wedded to J&J for people who got J&J, why we are not open to mRNA for people who got J&J. I want an answer to that question, so I'll be following this meeting. These are some of my thoughts on the FDA guidance documents that I have reviewed right now, and I'm giving them to you just as it comes to my mind. This is an exciting and also trepidatious time to be somebody who studies vaccine and drug policy and regulation. It's exciting because finally people are interested in what we're doing, interested in these kinds of things, but it gives me some concern because there is so much external pressure on the traditional process, and it wasn't made for that. It's a process that's great for peacetime. It's not terrific when the eyes of the world are on it and political pressures are on it. So we shall see. Boosters, I'm an old-fashioned doctor. I like randomized control trials measuring endpoints I care about. We shall see what the committee thinks. And until then, if you like this video, you know what to do. Like, subscribe, comment, leave a message. You can get more of this on this channel. Until next time.